Hi, everyone. So, continuing on the series of things to know before you get pregnant, we're going to talk a little about old injuries that I see frequently impact kind of the pelvic floor, the pelvis, and pregnancy. The reason I encourage people to address this before getting pregnant is the body changes really quickly during this time frame. And if you aren't trying to play catch up, kind of dealing with old injuries as they become an issue, it can make the process a lot more comfortable for you during this time frame. Again, there are always multiple factors that kind of play a part in having a full picture of your history and physical exam help to make any programming specific to you instead of just some random internet information that may or may not work. So let's talk a little bit about the most prevalent symptom first, low back pain. While about 80% of Americans experience low back pain at some point throughout their lives, the change in kind of the center of mass and gravity associated with pregnancy can increase symptoms due to just the rapid change in force on those tissues. It can kind of play off of decreased pelvis mobility, hip mobility, rib cage mobility, or even ankle injury. If something doesn't move, something else is going to try and move more. And having good hip, pelvis, ribcage mobility can limit the amount of force that's placed on the low back. Or if you're a more mobile individual, then strength and stability in these regions can help to offload. I'll always kind of address lifting mechanics and sitting and sleeping postures, which are going to be very individualized during this time frame. So ankle injuries are the sneaky injury of this group. Then you can kind of get your head around how hips, pelvis, low back, and rib cage are all going to be affected during pregnancy. But the ankle is kind of an odd one to notice the repercussions from it. So think of that one time in high school that you rolled your ankle and it was never quite the same afterwards. If foot and ankle mechanics aren't moving very smoothly during gait, what happens is you place a little bit more load onto the hip and the low back, either by shifting sideways or kind of collapsing onto the opposite side a little bit more. So if it doesn't have good stability, the brain might learn, hey, if I rotate my hip out or I collapse through the inner arch of my foot, I'm less likely to roll my ankle here. One of the easiest places that you can see if this is your tendency is with squatting. So if you notice with squatting that my toes point out a little bit further on this side, do you feel like your ankle can get the same mobility there? You might also notice a weight shift or decreased depth before you start to kind of curl into the low back. Prior knee injury or surgery is another factor kind of lower in the chain that will affect the pelvis and the low back. If that knee doesn't get fully straight or isn't as strong as the other side, you're not going to have equal balance and kind of load transfer within the pelvis. So making sure that you have appropriate challenge for this leg to address range of motion, balance, and higher level strength kind of prior to pregnancy can decrease compensation on the other side during pregnancy. So if you can tolerate kind of adding 20 to 40 pounds over that leg during functional tasks, you're training for what your body is going to adapt to during pregnancy. One of the exercises that you can try just to see how you do from side to side is stand on one leg. You're going to hold a 20-pound weight at your waist and see if it changes your ability to stabilize side to side. If you feel like you have an imbalance there, that's something you're going to want to address. And then we have the hip and the pelvis. So assessing range of motion can give you some insight into hip imbalance as well as pelvic floor tone, as some of the hip rotators make up the sides of the pelvic bowl. In order to assess this, what you can do is you can keep the thigh kind of in the same place and rotate the foot in or out. And you compare this on both sides and see kind of how it feels within the body. It can pull through the pelvis and create some pain either at the front or the back, and as well as load a little bit more on round ligaments if you don't have good mobility here. Self-assessing kind of throughout pregnancy as the body continues to change can help to limit any symptoms throughout or any compensation patterns that may start to appear. I also want to talk a little bit about how prior pregnancy can affect hip mobility. So if you have a longer labor, baby kind of gets stuck in the birthing canal, baby's rotated, any amount of birth trauma will affect mobility in this area. So in order for the baby to pass through the birth canal here, you're going to have a little bit of a shift at the pubic symphysis as well as at the sacral joints. This can sometimes get a little bit sticky if you're laboring on your side and that top side has to move a little bit more, and you might notice kind of a change in rotation within the hip itself. Sometimes this needs a little bit of a help to get back to its more mobile position, as well as addressing any amount of pelvic floor tension that might be kind of limiting the pelvis to move that way or scar tissue. And again, specific intervention is your friend. If you feel like something is temporarily effective or you aren't seeing kind of long-term changes over a course of time, it's time to reassess, look at the full picture, and come up with a new game plan. Specific intervention is always your friend. Thanks again for watching. If you have any other questions, let me know. Have a great day.